And we're live.
Hey everybody, we were tuning in today to talk about an Aerolase treatment. This is the only treatment right now that is approved for dark skin type. So it ranges for every color, but from your type 1s to your type 6s. We can safely treat with laser hair removal. We can also do a rejuvenation facial. Dr. Emer likes to call it his red carpet facial, so you can literally get it before you're headed out somewhere. It's gonna plump, it's gonna it's gonna shrink wrap your skin, but it's gonna make your cells look plumper. So you're gonna have a nice little glow to your skin. But especially, and this is why I think it's really important, for anybody who's ever done laser hair removal, you're just bound when you get into the darker skin types. So we're kind of treating jawline here, but it's effective and it's safe. It can be done in about 6 treatments, so the same as normal laser hair removal, but we're going to do it without causing any hyperpigmentation, any post-inflammatory hyperpigmentation. So that's going to be a big one, and also hypopigmentation, because that's a big one with our darker skin types too. We don't want them to lose pigment. So this is a great all-around laser. We like to use it. It's, like I said, great for every skin type. It doesn't hurt, which is another huge bonus. You're just going to have heat distributed across the skin, so it's going to kind of feel like warm water, but it doesn't hurt at all, right? Maybe even a hot stone massage, but it doesn't hurt. We're going to do a series of treatments about 3 to 4 weeks apart, depending on if we're treating hair or we're doing rejuvenation. But it's just a great all-around laser, so we're just kind of highlighting it today. Just so you guys can kind of see the laser. This is our amazing Aerolase. Has handpiece. And so here we go. So we'll kind of stay tuned. We're going to do a little bit with our patient here. And then if you guys have any questions, let us know while we're doing it. Once again, we are talking about Aerolase today.
So if you guys have any questions for Nurse Revay, please type them in. I'll be sure to shoot them over.
All right. Are you ready?
There you go.
Here we go. 1, 2, 3. This is also a really good treatment to do for patients that have active acne. We're able to shut down that inflammatory process, improve, so the actual acne does go away faster, and not just cystic or comedonal. So the surface acne as well as the cystic acne. Today we've treated about 8 to 10 patients, all different skin types, all different skin disorders as well. So we had some that have rosacea, so those are our real sensitive skin patients. They do great with this. We're able to reduce that inflammation, improve the skin texture on the surface, so they get a greater clearance. And pore size. The pore size reduction, I think, across the board is one of the best feedbacks we get from everybody. Is it painful? How's the heat? So just like any other laser hair machine, we're going to be able to target specifically. He does have hair here. We're not going to touch that. But this is when you get a lot of folliculitis, so you get that irritation when that skin or that hair tries to break through the skin, this is going to be the only way you can treat it. Whether it's on the bikini line or it's done on your chest or your face, if you get a lot of follicular edema or folliculitis, this is going to be, you do laser hair removal. For those that have done laser hair removal, it's nice that it's not painful, because that can be spicy. How are you on heat? Can you do okay? Can you go higher?
Okay.
Am I making you sweat yet?
No, okay.
Do we have any questions?
Just somebody asking right now, what is a CO2 laser, which is totally off the books, but...
Yeah, so CO2 is going to be completely different than this. That is more ablative, so we're actually causing a skin resurfacing. This is going to be where we're not doing any damage to the epidermis of the skin. What we're treating is actually underneath. So it's going to be the vascularity the water in the skin. So this isn't gonna, he can literally leave right now. I think he's getting on a plane later today. So he can get on a plane today. You would never know he even had a treatment. And you can do it with any skin type. So even our light patients that leave mildly pink, within an hour or two, they'll be back to normal.
Awesome.
Make them more heat. You guys can kind of see that little bit of smoke. I don't know if you can see it there, but that's going to be our clinical endpoint. So we're looking for a little bit of that. I say it smells like corn nuts. For anybody who's had laser hair removal, they have a different kind of analogy of what it smells like, but for me it's corn nuts. Do you want any of this here? Also different than regular hair removal is we can treat the hair faster. So most of the time when we're doing laser hair removal, depending on where it is on our body, we do it in different durations. We can actually treat him every 4 weeks with this. How you feel? You get more heat where you have more hair. Questions on there?
That's basically
so just to update everybody, we are doing an Aerolase treatment today. Safe and effective for every skin type. If you guys have any questions, make sure to give us a call at Dr. Emer's office. We'll see you soon.
Bye guys.